Hello, and welcome to Measuring Peer Recovery Outcomes presentation. This presentation was based on a toolkit that was developed by the Peer Recovery Center for Excellence, and the name of the toolkit is Measuring Peer Recovery Outcomes, Showing Impact of Peers in Meaningful Ways. Really long title, but some really good content. So we thought we would do a presentation on it. Now, you're going to have the majority of the material we're going to go over here in the slides today, but you can also find the toolkit in the files section in the course. So here's the agenda and what we're going to be going over. Little introduction here in the beginning. uh, Glossary of terms. We're going to talk about some of the definitions of some of these words in case you're not familiar with them. Evaluation, values, we're going to be talking about that. And then how do you implement these and evaluate what you're doing, right? That begins. And then some templates for you in the toolkit itself. So a little background on how they developed this. So the Peer Center for Excellence is based in Minnesota, and they were funded by SAMHSA in 2020 to provide training and technical assistance to the peer workforce, the recovery community organizations, right? People like Montana's Peer Network, and other organizations that are in the recovery, what they're calling ecosystem, to support the implementation of peer recovery services. And I have to assume that you chose this training because this is an organizational development um, course, right, that we have. And we have a whole bunch of those in our catalog where this is really good information. And basically, we're breaking down what they've presented. And the Omni Institute is a nonprofit social science consultant, and they help with research and evaluation. And so they worked really closely with them to develop this content. Okay, so if you're not familiar, a toolkit is just a set of resources designed to help a particular audience, achieve a goal or a task. And here we're talking about the implementation of peer services. There's lots of various resources that can identify program values or outcomes or help you do the measurements and develop strategic plans for sustainability. This is just one, right? And again, this is aimed at peer support services. So some of the basic definitions here. Recovery, as SAMHSA defines recovery as process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. I often ask audiences at this point, what do you think about that definition? One of the things that I think about when I read it is that it doesn't say substance use. It doesn't say mental health. It doesn't say trauma recovery. It just says recovery. So you may have to broaden your view, I don't know, but for some people, they have to sort of broaden their view and how they actually view recovery and what does that actually mean, to live a self-directed life and strive to reach your full potential, right? And then throughout the document, they will use PRSS. And this is what they're referring to, peer recovery support specialist. So if you're here in Montana, we have family peer support specialists, we have behavioral health peer support specialists. It's the same thing, it's just a different title. That's just what they're utilizing um, at the Center for Excellence. Okay, so what are the benefits of doing an evaluation and taking a look at your program? Because I think one thing that I've seen over the years, ever since we began 2017, really implementing peer services, is a lot of organizations are afraid or they shy away from actually evaluating what they're doing, and certainly peer supporters are nervous of that because it's still a developing profession. We're still trying to understand it, but this is how you improve, right? Because It provides this opportunity to reflect on your progress and what you're doing. It helps build the capacity, okay, of what you're doing, the expansion of what you're doing, and we get to engage the community within recovery, the community within the client, the community within the staff, but the community in which you exist also, right? You can use the data to influence policymakers and funders, and you need to understand what works and what doesn't work, and not be afraid to take a look at that and make changes. And it also will tell you where are we at and what direction do we need to go. Do we need to make a course correction and kind of move, right? And then sustainability. We have to constantly be thinking about how do we sustain these programs. We build these programs, and then if you have a grant, right? Everybody knows you get a grant, it's good for a year or two, and then the money goes away and the program just poof, just disappears. Sustainability needs to be built in from day one, and that's part of your evaluation. And then it also strengthens the accountability of the peer workers themselves. And so that's vitally important. And this is where I said earlier, peer supporters, they kind of sometimes will shy away from this, but we need to know, are you working within your scope of practice, the outcomes to show the successes and work on the improvements. So for those of you who are not peer supporters, the value of peer support services, right? Um, Peer programs are unique and they're specific to different locations or intended populations, and they may focus on particular objectives or goals, and it's not universal. Okay, you have to understand this piece of it. It's not universal. If I'm running a peer support program and I'm working in a emergency room, right? What I'm working on at the moment is very different than somebody who's working as a peer supporter in a 30-day treatment program for substance use, right? They're two very different settings, and the job of the peer supporter is going to look different in each of those. The goals that they're trying to achieve in their work, right, is going to be very different. So there's some variance in it. We need to be able to show the value of peer work, and this will go towards enhancing the sustainability. And then in the workforce itself, or the field, the work, right, the field of peer support, at the time of this recording, we have a little over 200 certified peer supporters in Montana. And this field is continuing to grow, not just here in Montana, but across the whole nation. And it's because we're learning about the effectiveness and how to implement it. And every one of these programs is demonstrating that, regardless of the location. And we're learning along the way. We're learning, we're learning, we're learning. Whatever year that you're reviewing this in, 2017 was when legislation passed and we created the profession of behavioral health peer supporters. 2025 is the creation of family peer supporters. So we're learning along the way, okay? And we have to demonstrate that a peer support program, like a drop-in center, for example, it has value. We have to be able to demonstrate that. That's part of the work of a peer supporter, and that's embedded in the training that Montana's Peer Network does. We talk about the importance of data collection and evaluation with the peer supporters when they're just starting their careers, so that they understand that this is part of what we're here to do. So, what are some of the challenges in doing this? Right? And the first one that always comes to mind is that we tend to overly rely on subjective information. We have these stories that we tell about a person or persons that we helped, particular program, but we don't often have the data. Again, I said this in the beginning. We're not collecting enough data because I think agencies and peer supporters are reluctant to do that, and or they're overlooking it, right? And Peer support recovery programs adapt to individual needs, making consistent outcomes hard to track. We don't think sustainable. We don't think long term. We just say, oh, my job is to go out on the streets and meet with people who are living on the streets and engage them in services. But what if we were to track those individuals, through a period of time, not just did they get into services? It's like, well, then what happened? They went to treatment or, inpatient, outpatient, the state hospital, wherever. Like, how would we do that? Another one of the challenges is this lack of standardization. Now, again, this is coming from a national perspective. I think in Montana, we've done a pretty good job with standardizing the training and the consistent message, the scope, the ethics. I feel like we do a pretty good job of this in Montana. Can't speak nationally, across the spectrum. So these are some of the challenges, and we'll talk about these throughout this presentation. Okay, the value-driven evaluations, right? A lot of talk about evaluations here, right? We need to have intentional alignment with the program's purpose and goals. So if you're getting funding to run a peer program, then we have to align. And it might sound like, well, yeah, of course we do, Jim. But I will tell you, there's a number of peer support programs running right now that do not. They don't align. And then the program is like disjointed. The funding is for this, but they're doing this. They're doing something different. So it's really hard to measure that. And the program itself influences the evaluation. And then how do we, again, focus on the impact, right? That what are we actually doing? What are we impacting? What's the long-term impact to the individual, the program, the communities involved, right? Common value of peer recovery support programs is the self-determination of recovery goals. Absolutely. This is part of the work of peer supporters. This is where we differ from clinicians. Clinicians are making treatment plans based on the clinician's perspective. Peer supporters are helping people make recovery plans based on the individual's intentions, goals, how they're striving to live their best life, right? So clinically, it's very different from the way it looks in a recovery-based program, a peer-driven program, right? Traditional evaluations may attempt to standardize the goals, right? Cut and paste, cut and paste, cut and paste, cut and paste. We have templates and we just cut and paste and we throw it inside everybody's file. That's not in alignment with peer values. So that's one of the issues that we end up facing, right? Value-driven evaluations focus on measuring the individual's recovery goals, not the other way around, right? Because recovery is not a one size fits all. It's not at all. And this is where I think the system-based treatment confuses itself and thinks it's recovery. Treatment is not recovery, and recovery is not treatment, right? They're two different things, and we have to understand that from the beginning. Okay, so here's where we're going to kind of start getting into the nuts and bolts of what we're doing here. So implementing value-driven evaluation for recovery support services. First, we got to identify the values. We have to choose relevant outcomes to the program. We have to select the evaluation tools we're going to utilize. We're going to develop and implement a plan. We're going to collect data. And then we're going to develop an impact or sustainability plan. Okay, program values are the principles that guide the goals of the program. So define your core values. Integrate your values into the mission. I would add mission and vision and your goals. And you have to engage partners. Who are the community partners? Who are the and they're calling it critical partners, but I would just say, who are your community partners who need to be involved in helping you develop some of these? And you need to regularly monitor and measure the program's performance. So this can be through a advisory group. This could be through monthly. I don't like to go longer than that. I don't like quarterly evaluation. I personally recommend monthly evaluation. And then we need to be able to reflect on the evaluation process and the outcomes. In other words, what is the data telling us? And if you build this in from day one, it just becomes part of what you're doing. Being a peer supporter and running a peer support program is not just about providing support to people. This is all the behind the scenes. So this is your peer supervisor, your program director, right? Who needs to be given the responsibility to understand what are these things and how do we put these into place, but also be held accountable for doing them. So typically, these are going to be the core values you're going to see in a peer support program. Again, self-determination. The person determines what their recovery pathway is going to be. We empower them and help them with choices. How do we integrate not only the individual, but the program into the community so that's not this isolated program? That's the way we used to do things in the last century. That's not how we do things now. The program is not, down the alley in the back of the building. That's where you go for recovery, hidden away. We're front and center now, right? We have to, as peer supporters, provide a sense of hope and strength. And this piece around self-help, mutuality. As a peer supporter, I need to be sharing. I'm in recovery. I need to be sharing my story. I say this in training all the time. I say, if you're not telling your story or parts of your story every day in your job, you're actually not doing peer support. And I'll say that again. If you're not sharing your story with the people you're working with every single day, you're not doing peer support. You're doing other things. You're doing admin. You're doing case management. You know, that's part of the deal. It's peer support. I'm working with my peers, and I'm only there to support them. They get to choose their own pathway. And then the piece around self-efficacy and people making their choices in the services that they want to do and having a voice, feeling empowered, right? And and growing and developing themselves emotionally. These are typically the values, and some programs will have others that you will add in, but these are kind of the core ones that the Center for Excellence has identified. I would support these, and I would actually add things like I think personal responsibility is a big one. I think in all the programs we run and the work that I do, my approach is there has to be this piece of personal responsibility for the individual that's getting receiving the support and for the peer supporter. Okay, so one of the things they put in this toolkit were these guiding questions. We have a few slides around this. So these are the questions you want to write down, you want to take note of, and you want to work on answering because I can't answer these for your program, right? So does my program, does my organization already have a set of values? Or are we just winging it? Or is it the values of the clinicians, right? If you're working in that type of environment. So uh, I'm going to start with the no. No. Who is the best person to facilitate intentional conversations around program values? What voices need to be included? Well, the voices that need to be included are the people who come in and utilize your program. So if you're running a drop-in center, for example, you're going to invite your guests, the customers, to be at the table. You're going to invite the staff. You're going to invite community members, right? Other agencies that you work with and clinicians and administrative people. It's a big group. What recovery models does your program utilize? Do you know? If you don't know what your values are, you probably don't know which models. In other words, do we only promote AA and NA, like 12-step groups? but we don't realize that there's other options out there that we could be promoting and offering. What values align with the ones you do use? So an example of this would be if you were running a program and you only used 12-step programs, AA and NA, that's one model of recovery. That's what it is. It's one model. There's lots of models. It's one model. That's not offering choice to people. That's not empowering to somebody who's atheist because they're not going to believe in God. So that goes against the person's individual values. How are they going to commit to going to recovery groups? How are they going to see value in that for themselves as an individual if it goes against their own belief system? This is why choices are so important. The system tends to be very limiting. Okay, so those are some of the no's. Now let's flip to the yeses. So does my organization or program already have values? Okay, do they align with the services being provided? I'll give you an example. There's a couple of programs running across our state at the time of this recording who receive money to do A and they're doing B. So the money is for A and they're not doing A, they're doing B. And then they wonder why the program is disjointed and they're not having any success. Well, it's because you're not actually even doing what the money is actually outlined for you to do. You're taking someone else's values, the entity who applied for the money, and you're trying to overlay that onto a recovery program, a peer support program. But the money is for A. Okay. Second question, do they align with the values of peer recovery support services overall? Are there any adjustments that need to be made? Yes, no. You can only answer that question. Okay, relevant outcomes, right? So we've identified the values. I've given you some nationally recognized values. You may have others that are important to you or important to your program or your funder or the people who come in. You have an advisory council. These are the items you've already established. They're very necessary and can get people really fired up about your program because, hey, we're all here. We all want to help people, right? We have to make sure that they're measurable, and we're going to talk about that in a couple slides here. And we're going to choose outcomes that are specific. And we can place them into like three buckets, if you will, short, medium, and long-term goals. One of the things we do in my organization is we use the OGSM model. If you're not familiar with that, you can look that up. We actually have a whole course on OGSM and how to utilize that. That's what we do. But the whole idea is within the OGSM, you have the short, medium, and long-term goals because the only way you're going to address a sustainability is you have to do things throughout. Some of those are very short, some of those are kind of medium range, and then long-term, the lifespan, the life cycle, right, as it circles around might be 1 year, 2 years for your program. So you have to think about that. And this is where people get excited and people get passionate. And this is why when you don't have these pieces in place, why programs begin to fail right from the start. Okay, so some of the areas that you're going to be taking a look at, right? So in personal skill building, right? Um, People's beliefs, their personal values. I've talked a little about that. What's their self-awareness? Often when people come in, they don't have very high self-awareness of what's happening, right? That takes time. What's their motivation? We teach peer supporters about the stages of change. Self-management, not agency-based management. We're not here to manage people. People need, again, to make their own choices. And the underlying one that most peer supporters will tell you when we talk about what's important, hope. We have to provide a sense of hope. Our program that their life can get better. No, nobody wants to be living on the streets, addicted to drugs, and have untreated mental illness and health problems, dental problems, diabetes. No, nobody wants to be not taking a shower and wear clean clothes and not have any money. And peer supporters are the role model to show people. They provide that beacon. It's like the lighthouse on the shore. It's like you're flashing out this beacon to people to say, hey, I'm in recovery. I've been there too. This is my experience, that sense of hope. I mean, that has to be in every peer program. So, how about on the community side? So, they're talking about things like engagement in services, interpersonal relationships, perceived community belonging. Could be like jobs, housing, right? This list can be really big on this side. So these are some of the areas that you might be focusing on in your program. You can add to the list. These are just ones that have been identified in the toolkit. Okay, and then here are your guiding questions, your values. Have you established any outcomes through your program development? Uh, If you don't have pre-existing outcomes, like often the funder will want certain data points collected, right? Um, what do you want to do? How are we going to measure? How are we going to show our funder that our program is worth funding again? And when we don't collect the data and we don't understand what the program is about and what we're trying to work towards, then why should you be funded? They'll just fund somebody else. They'll just move on to the next program. you know and are you going to share this? I'm going to keep going back to this advisory group, talking with people and getting input. And are you sharing these? Are these on your website? Are they in your literature, your brochures, your handouts? Is the information available to people, or is this all going to just be internal? You could put things like posters on the wall. Here's the values of this peer program. Here's what's important. The system looks at these things like, oh, these are the rules. Don't do this and don't do that and don't do this. That's not empowering to people. Peers don't view it that way. We're much more accepting, and we need far less rules. You know, we just don't need that if we have these core values around hope and empowerment, responsibility, self-determination, the guiding principles of recovery. If you're having trouble with this, look up SAMHSA's Guiding Principles of Recovery, and we have a course on this, and really embrace those things. I mean, at MPN, we made a poster, we call it the recovery wheel, and it has the guiding principles of recovery, and then it has what the role or responsibility is for the peer supporter in that particular principle, and what's the responsibility of the individual, the peer. I mean, that's what this is about. That's what recovery is really about. It's not about somebody else making a plan for you and you jump through these hoops and, oh, hey, you're in recovery now. That's not what recovery is. And if you have that perception, you need to reevaluate whether or not you're actually even running a true peer recovery program, or whether it's just, uh, again, somebody else's values umbrella over the top. And so we're not really guiding people and helping people in life in recovery. We're after the bottom line, the cash. This comes up a lot, and this is one of the big challenges in our broken behavioral health system. Is that we have to stop chasing the money and we have to start focusing on the individuals and the outcomes if we really want to change society. Okay, so this section is about what tools you want to use, and so we divided this into a couple different columns here for you. There's a lot of information in the toolkit about this. So one, you can use existing tools. And the pros to doing that is the tool is ready to go. OGSM, I already mentioned it. It's a standard. It's used in the business world. You can use that model, you can work with it. And is it possible to compare with groups outside your program? So however you're measuring yourself, go find another program somewhere, whether it's in Montana or across the country, that's doing what you're doing and see what they're using. There's all kinds of software programs that you can buy. You can use smart goals, and there's all kinds of apps, and right. The cons are that if you use pre-existing, then the questions are more generalized because it's like a one size fit all template, right? And you might not be able to change things to customize it, right? Now, excuse me, talking about customizing, if you make your own tool, right, then you can fit it to your program, and you can tailor the questions, which get you the outcomes, right, the data, to what you need. And you can make sure that it connects with other community partners. The downside of this is it takes more time to develop. And I know when I started as a peer supporter, I mean, I literally was using like Microsoft Word. I mean, I was just typing up surveys, paper surveys, and handing them out to people with an anonymous box with a slot in the top. They don't put their name, no identifying information, and they just fold it up and put it in the box. And then when we have a meeting, we open the box, right? The evaluation, our advisory meeting, we open the box and we read through them, right? Um, you may need help if you're doing something on your own. You may have to consult with somebody. Montana's Peer Network is always open to this. We're always open to helping people do those kinds of things. And you might not be able to compare it with other organizations because you've customized, made your own, and it might be a little bit more difficult to do that. Okay, here's your guiding questions for this section. And again, I said this in the beginning, I probably haven't said it enough in the presentation. The toolkit is in the files section of this course. So you can get the whole toolkit. So when we're talking about what evaluation tool you're going to use, maybe it's Excel, maybe it's, as I said, a Word document. Maybe you're going to buy software, buy an app. There's lots of recovery apps now. People have made all kinds. If you have a recovery home, I mean, they have apps you can use that are already developed for you. And a lot of them are just pay as you go. So you're only paying for the number of people utilizing it. So you decide what tools you want to use. And how do you fit the tools into what values you've identified, right? If you don't want to use a pre-existing tool, or you're going to create one, that's fun to do, you know. But if you don't have the skills, that might not be an option. Are there costs like we buy an app or we have somebody develop software for us? We tried to do something many years ago. We looked nationally to find someone who could help us develop a data collection tool. And we had a hard time finding somebody to do that because it's like they didn't speak the recovery language. They wanted to use all these other tools, and it was really tough. I think we interviewed like 4 different organizations that said they could, but when it came down to it, they actually couldn't. And we ended up having to create our own, right? And there's things like SurveyMonkey, for example. That's you can buy a subscription to SurveyMonkey. It's rather inexpensive, as long as you keep it rather simple. But for $1,000 a year, you can buy a subscription, and they'll collate some of the data for you. But you'll even find with a program like that, you can't view the data in all of the ways you want to. You only have a limited number of choices in the way you can view the data, right? And so that can be a problem once you collect it and you want to share it and look at it, right? Because if you have 10 people on your advisory council, how are you going to share it? So those are some of the challenges that come up. And then is there a length of time? Is it time sensitive in terms of like, people will get a grant, and let's say it's an 18-month grant, they think, oh, well, you have plenty of time. But no, because it takes a few months to get up and running. And then if you have an 18-month program and it takes you 3 months to get up and running, you're down to 15 months. That's not a lot of time to run a program, right? Like really hit your groove and work out all the kinks. And so you do have to move on this quickly, and it really should be in your original proposal for your program, your business plan, your grant proposal. You need to include these kinds of things in there. What are you going to use? Okay, this section is all about the development of the implementation plan. So these are the things we have to consider with our plan. Who's going to participate? Who's who's a part of this? Who's going to administer this? Is this a survey? Is this a link you're going to send to people? Is this something that gets filled out? We ran a pilot program where we had these tablets, and after every peer support interaction, we asked the individual to fill out a survey. And so we could just hand them the tablet and they could answer it. How often are we going to do it? Is this every time? Is this weekly? Is this monthly? Is this quarterly? And you really shouldn't be going longer than quarterly, but you need to be collecting information. Where are you going to store it all? Because you're going to be getting all this data. Who's administering it? How's it going to be stored? Are you storing it in spreadsheets? Are you putting it into graphs? Are we sharing this information, right? Um, and if you have identifying information in there, which most data collection points don't, but if you do, you have to have release of informations. Are you sharing this with other entities? So do we have to have agreements? Maybe there's an outside entity that's going to do it for you, right? Maybe you have the funding and you could have somebody on the outside doing it. So you have to think about these components to the structure of the plan. So the who, what, when, where, right? So who's responsible for the process itself? There's got to be different individuals responsible so you can keep each other accountable. What steps need to be considered to implement the evaluation tool? Okay, what do you need? Did you forget to put this in your grant proposal so now you don't have the money? Do you have to go get extra money from somewhere, right? Can you take some of the budget and ask your funder, can we shift this over? We need a few $1,000s to do this evaluation piece. We didn't budget for it. What is that going to actually look like in your program? Where will it take place? Again, is this links? Is this an app? Are these paper surveys? What are these? How are you going to do this? And how is it available to people? The integrity of what you're doing. And I will tell you, my experience with this is the most important part is who is responsible for it. Again, I like to do data collection one every month, collecting, collating, discussing, reporting every month. Now, there are funders who they don't want to read it every month. They say, send us every 3 months. I find that if you wait 3 months, it's really hard um, to make adjustments because here's what happens. If we collect data, outcome data in January, February, March, we're not looking at it till April. So it's actually 4 months. Now we need time to process it intellectually, collate the data, talk about, oh, wow, we're seeing this. We need to make a shift. Now we have to come up with a plan. And by the time you implement the plan, it's 5 months later, but you're on an 18-month program. So it's like 5 months. I like monthly. Collect the data every month. We're going to look at it. Do we need to make adjustments for the very next month? Nonprofits tend to be more quicker and agile than the system, the big giant behemoth of the behavioral health system. The smaller your organization is, the easier it is to do these things. When you work for these big behemoths, they don't move very fast. You have to get approval from 5 different people before you can you can do something. And that's a hindrance to the implementation, correction, adjustments of the data that you're getting in because it just takes too long. So you have to think about this element. Okay, so they've got some tips in here, and we want to share the ownership, share the responsibility of this. It's not just about the individuals working there, the people coming in are part of that, partners are part of that, all areas of your organization, from the way you market it, if you even market it. Some people don't even market their programs. Um, we have to be really clear. Again, this is why I like OGSM, right? Objectives, goals, measurements, OGS and measurements, right? Objectives, goals, strategies, measurements. Sorry, flip those two around. That's why I like it because it's like super specific and you can do short, medium, and long term. Um, are you going to build the evaluation into like an intake? If you do intakes, I mean, I know like some places do intakes. If you're in a recovery residence, you're doing an intake, but if you're in a drop-in center, there is no intake. So your setting again is gonna determine that. Um, are you going to stay in contact with those collecting data? There's going to be issues. You're going to see in the data. It's going to come up. Peer supporter number 7, whatever. You know, only spends 12 minutes working with somebody. Peer supporter number 3 spends 45 minutes working with people. So there's a conversation. What's going on? Why is one person shorting the meetings and making more meetings? Or are they just shorting? Like you're going to get data like that. And what does it mean? And we can't jump to conclusions. It doesn't mean one is not doing their job and one is, but like what's going on? Maybe it's shorter meetings more often and it's longer meetings less frequent. There's things like that. So people are going to have to sit down and you're going to have to talk about, hey, this is what the numbers are showing us. Maybe certain people won't work with folks with certain mental health diagnosis. They refer them out all the time. Okay, so do we need to bring in some training? Do we need to work with people, some coaching with their clinical supervisor, right? And then incentives for people participating in the evaluation and the people collecting the information. This is one of the tips that they recommend to think about. Okay, so where will the evaluation tool be in your organization in the daily workflow? How does that get fit in? Or do we just ignore it till the 29th of the month and then we do it? We have to build this in. I think my recommendation, what seems to work best in my mind for peer supporters, these are peer supporters that I've employed, but also peer supporters who work at agencies where I've consulted, talked to the peer supporters, talked to the directors. I think you have to find a balance for your peer workers that if they're working 20 hours a week, you can't expect them to do 19 one-on-ones every week. I think you have to find more of a balance and say maybe they're going to do 12 meetings, and then in the other 8 hours, they're going to be doing this kind of stuff, outreach. They're going to be doing meetings. They're going to be doing clinical supervision. They're going to be doing training. They're going to do some of this data collection, this like actually collecting, collating the data. So it's more administrative type work, right? Documentation would be another one in that category, and not expect them to, I'm working 20 hours, so I'm going to do 19 hours of one-on-ones with people. There's no room in there to implement the data collection. So you can come up with the best plan, but if you don't allow your peer supporters time to do those things, how are you gonna collect the data or analysis or do an analysis of the data, right? To collate it together to see, well, what does this actually mean? And then when to implement. And I've said this already, and I'm going to say it again, it needs to be from day one. You need to do it from the very beginning. This is vitally important to get a full picture. You want as much time as you can collecting data. And then you need to provide resources that will support the implementation. Do people, if it's software, for example, Do your people need to be trained on how to use it, or are you just going to have them stumble around and try to figure it out? Same thing with if you're using like an app or a link, the individuals who are filling it out, do they need some instruction on how to use it? So we're not just clicking answers and now you're not getting accurate data coming back in. This is vitally important because that can totally skew what you're doing. If they just choose the first answer in every question, that's a problem. Okay, so to finish out this section, here's your guiding questions you're gonna take back to answer. Are you evaluating one or multiple services or settings? In other words, does it need to look a little different? One setting might need to look a little different than another. What's your capacity? Who's going to do it, and what's the person's capacity? How many hours of time need to be allocated to this? This is why putting this in your budget in a grant is so important because you can allocate the time or the individual. It might be a separate individual who actually does this. Do you need things like tablets, for example? Certain technology, is that going to be needed? And then where are you going to store it all? Are you going to store it in the cloud? Are these actual paper surveys? So where are we storing this stuff? These are some of the questions in this section for you to consider. Okay, so when you're collecting the data itself, right? Here's some of the questions you're gonna ask yourself, and you need to for the evaluation part of this. Is the data complete? So one thing that I've learned over the years is that when you're doing data collection, there's going to be a percentage of individuals who aren't going to answer all the questions. So if I have surveys from 100 people, okay, there's a percentage of them, and that percentage changes all the time, that will answer a portion of the questions, but not answer the other portion of the questions. Then there'll be some that will answer the second half of the questions and not answer the other ones. I mean, there's a piece like that you have to consider. You're not going to get 100 surveys with 5 questions and all 5 are answered. So you have 500 responses. It's not going to come out that way. And we have to understand that. Does my tool collect the information I want to collect? So I took this course a long time ago when I first started, and I had a drop-in center program. I took this wonderful course. It was a few hours, and it was about data collection. And it's very interesting. And I've used this, what I learned in that class, I still use it today. And I think, wow, like for a 2-hour class, I learned a lot in that class. So when we're determining what we're going to ask, this is why there's so much in this toolkit around the values of what do you want to know? How will you measure the success of your program? Start with the answer and work backwards. Okay? So, for example, an example of this would be if I want to know what my peer support staff is working on with individuals, I can always ask my staff, but really, I want to ask the customer. I want the customer to tell me what they're working on with the peer supporter. So I'm working in a backwards way and utilizing, I've done this in a number of surveys very effectively. Here's the question. Which of the guiding principles did you work on today with your peer supporter? And the customer picks, including, I don't know, we didn't work on anything, can't remember, right? Like, but now the customer's telling you what. So I'm working in a backwards manner because the peer supporter, they're going to be biased. I mean, they're going to tell the boss what they think the boss wants to hear. So you work in a backwards manner. What information do I want? I want to know what my peer supporters are working on. Are they working on the 8 dimensions of wellness with people? Because that's what our funding is all about, is engaging people in wellness. So you can use that tool. and work in a backwards manner. I found that very successful. So this is the does my tool collect the information I actually want to collect, right? How easily can you analyze the data you're collecting? If you do paper ones, that's easy to read. It's not easy to collate, meaning how do I put it all together into a graph? If I use a SurveyMonkey link, which is right the big data collection software app you can use, it will do that for you. But you're going to have to pay for that, right? And am I using something so I can store it and access it again? I mean, there are programs we've run where I still today, when I write grants, I go back and I look back at data, or I think about, oh yeah, what was that? We were collecting data on, and I go back years later, a decade later, and I'm still able to access this information to compare and contrast what's happening now. So this is an important piece of this, right? If you put it on somebody's computer and that person leaves, or the computer gets dropped, and broken, are you going to lose all the data you've collected? Okay, here's some terms for you with data collection, okay? And I'll tell you, I didn't know these before um, I read through the toolkit, you know. Data cleaning means checking the entries that they're complete, not missing, and they're aligned with what you're measuring. I kind of mentioned this in the previous slide. Frequencies refers to the number of times something occurs in the data. To calculate frequency, sum the report data and take a tally of the occurrences, how many are coming in, right? And one thing I'll say about this thing with frequency is uh, guarding against people stacking the results. See, if you do paper ones and you put a stack of paper surveys out for people to answer, they can fill out 5 of them and put them in there. SurveyMonkey has a feature where you can limit the link. You can only use that link one time. You can only use it, you can only enter the data. And if you go to click on it again, it'll say you already took this survey. So that's an interesting little consideration when you're building your collection, the way you're going to collect the information. Means is or average of the data set, the sum of the values, and then divided by the number of occurrences. So again, if I have 100 surveys and I have 5 questions, right, I'm going to multiply that out. Um, and this helps to provide a general picture of the data set, or how much I have, how much have I collected. I also think time is a big one here too. That's also another one. And then of course percentages. I think most of us are good with percentages. And remember, when you're collecting data with percentages, you can flip it. There's 2 ways to look at it. I'll give you an example of what I'm talking about here. Um, so if I ask people, um, how how would you rate, or how supportive was your interaction today with the peer supporter? And I do it on a scale of 5, and I say very helpful, right? Somewhat helpful, average, what I would expect, a little below average, or not helpful at all, right? So people are going to pick whatever they felt like today, okay? And And then I can collate that data, right? The data set, I can collect all that together, and it gives me an outcome that says 80% of the individuals surveyed said the peer support they received today was above average. That's a pretty good number. But you could also say it the other way. I could say 20% of the people surveyed this month found that the peer support they received was average to below average. You see the difference in those 2 things? The data is the same. 80% said it was above average, which means 20% said it was average or below. So that's the area you're going to work on improving. I want to lower the 20%, which means I want to increase the 80%. So this might be skill building. This might be sharing the data with my peer supporters to say, hey, we're getting 20% for the last 3 months. We've been getting 20% says average or lower. What are some ideas that you have on how we might increase this? Right? I mean, you can spin it both ways. Data and numbers, percentages work both ways. When you see it, when you see a thing that says, 52% said this, it means 48% said something else. I mean, we're basing, right? So you have to understand that, and it depends on what you're doing. If I'm writing a grant, I'm going to share the 80%. That's going to go in my grant proposal. If I want to improve my program, I'm going to look at the 20% and say, how do we move it to 15 or 10 or whatever number you want to move it to? I mean, you're never going to get zero, then your data would be false. That would not be accurate. No one's going to think it's above average all the time. So you have to understand these things, and you have to look at the numbers from both sides. That percentages can be flipped on either side. Okay. So this leads us right into what telling the story of our program. Funders love this. Media loves this. This is the kind of stuff you put on your website. This is stuff you put in a newsletter, or you send it out an e-newsletter to people, you know, and we have to always re-examine our goals and the setting in which the program is operating. Is it a recovery home? Is it a drop-in center? Is it an outreach? Is it a crisis thing? Are we in an emergency room? So we always got to be looking at that. Um, and what's it saying to us? And what's the plan to address the 80% or the 20%? Like we should be doing both, right? And what's the impact to the services? Do we need more training for our peer supporters? Maybe that's what it is. You could have one peer supporter who's lacking in some skills, or maybe it's the whole team. You'll know that by, well, which peer supporters? Is it one peer supporter that's always getting the low end, average, or below average? Or is it across the board? Or is it with certain individuals? Is it in crisis situations or mental health situations or trauma situations, or is it when people are suicidal? You can evaluate all these things if you're willing to take the time. And then how do you put all that together in a package? So we have a training on writing a grant narrative, sorry, a, yes, a grant narrative, like a report you would send into a funder, you know, and the format that I teach people is, your first paragraph is a summary, words, tell the story in words. Your next section is where you get to put in the data and you get to say and reference these numbers. The next section is your challenges. While we see 80% of the individuals receiving peer support services say it's above average, 20% says it's average or below. So as a result, we're going to increase continuing education, right? And we're going to sit down with each peer supporter and have them identify their strengths and weaknesses. You're going to tell the story of what you're doing, and that you're not just collecting data to collect data. You're collecting data because you want to make the best program possible. I think for a lot of organizations, they get funding and then they just sort of disappear. Like it's just like, and to be the best, if you want the best programs, the best outcomes, you have to work for it. And this is the behind the scenes work that helps you improve what you're doing on a weekly, monthly, quarterly basis. Okay, so let's talk a little bit here about monitoring, your data. I've already touched on this a little bit, but you gotta allocate the time for people to do this. You can't expect people to fit this in while they're doing the rest of their job. This is part of their job, so you have to allocate that. We have to constantly be checking on it. Is the data accurate? What are we seeing? What are the trends? And we need to ensure you can easily follow and find the information for when you're reporting. Don't wait till the last day to put data in. I mean, I do my best to try and put data in or begin making my reports early. Now, some months that's not possible. Sometimes I can't do that, but that's a scheduling issue on my part. Don't make that your habit. Just make this part of the job, part of the program, the job for the individuals, but part of the program structure and what you do. Okay, so who are you reporting to? I was using the example of a grant. You're doing a grant report, but maybe you're putting the data in a newsletter and you're going to share it out to clients and community members. Maybe that's the way you're sharing it. Maybe you're doing it for the website. What's the goal of the report? To me, it's about saying this is what we're doing with the money you're giving us, right? I talked about the format. You can use any format you want. That's just my recommendation. I've been using that format for over a decade. I find it works really good. I find that agencies really like it. Now, sometimes you'll find a funder who will actually put the reporting form in the grant. They'll actually give you in the appendix, this is what we want you to report on. And if they don't, then you develop your own, okay? And how will you show the data in the report? I don't think writing reports that are long, multiple pages, is worthwhile because I don't think people read them. I try to stick to 1 to 2 pages for my reports. Now, there are exceptions to that. So we have one where we report on 17 different components. So my reports tend to be 4 or 5 pages long. I've had another project where the funder required a report, and the report needed to be 9 to 15 pages because the list of questions that I had to answer for the funder that they provided, that's how much you had to report. So these are other considerations that sometimes are totally out of your control. This is what the funder wants. They want more complete, but if they don't, 1 to 2 pages is enough, especially if you're doing monthly reporting. I think the longer you go, the longer the reports are. Thus, an annual report might be 12 pages because you have 12 months worth of reporting. Um, the more reporting, the better. Are those available to people? These are things. Who's going to read these? Do you just fill them out? Does one person fill them out and send it in, and no one ever reads it? That's not very effective, right? Okay, sustainability. This is something again needs to be written into your proposals. When you build your business plan, you write your grant proposal, how will you sustain this program? So sustainability planning is a reflection on your results of your evaluation and identifying ways to integrate the lessons learned and resources to improve your program. Sustainability planning reviews the work involved in each phase and asks whether it is working and whether adjustments need to be made. And two things consistent is program funding. One of the things we did here at Montana's Peer Network way back in 2013, we were given some funding and we developed a program called Healthy Minds, Healthy Bodies. If you're familiar with us, you know we have this program. It's what we're known for. That funding was for 3 years. We went out, we did these trainings, and they were live in-person trainings. We did them all over the state, large communities, small communities, native communities. And the way we've sustained that program, we are 12 years later, we're still running that program without fund from the original funder. That funding was only for 3 years, by creating a book. So we took all the content, everything that we learned, and we created an actual book, a workbook for people. This is how we sustain this program. And we've been doing that for years now, right? So we learned all kinds of things doing these presentations, and we tweaked it and perfected it and did all these live, took input from people. And while we didn't have formal surveys, we made notes after every one. We had meetings, we talked about it, we improved it, and we took all the best of and we put it in this book. And this book we're on the 5th edition. We keep on improving it based on feedback from people, updates, latest information, best practices. But that's an example. This is something a person could buy, right? And I remind SAMHSA of this, and I'll send them a copy when we do new versions of it, updated versions, and I send them a copy and I say, thank you. I say, you helped. And in the beginning of that book, it talks about the project. That's a way you can sustain things into the future, because this notion that you're just going to keep getting money from a funder forever and ever to run your peer program is false. Life cycle of a grant, average grant is 2 years. So how are you going to continue what you're doing? You have to find ways to sustain it. This is just one example that I'm sharing here, right? And so it's always about evaluation, improving, and how do I keep this project running into the future? How do I do that? Now, this slide has a bunch of questions on it for you. What are the program successes? What opportunities exist for program growth? Maybe there's a partnership you haven't thought of. What changes need to be made so you can capitalize on opportunities and grow the program even further, right? Where are you at in your evaluation? You know, okay. These are just questions that you're going to ask yourself on an ongoing basis. You know, do I have adequate staff? There's nothing worse than overburdening people where they don't have enough staff to do everything that needs to get done. And I'll tell you, the number one thing that people will let go is data collection. If you don't have it properly staffed, people won't collect the data because their focus is on supporting people. As peer supporters, that's where the focus is. So those things start fading away. So if you're shorthanded for 6 months, you might miss data collection for 6 months because a person's like, hey, I'm totally overworked. I'm the only one here, right? So you got to think about these things, and this is all part of the evaluation, right? The other thing I want to say about this is don't be afraid to get multiple funding for the same project. And I'm not talking about duplication. I'm talking about you get funding from source A, and maybe it pays for 75% of your program. But there's 25% of what you want to do you don't have funding for. There's nothing wrong with going out and getting funding to pay for the other 25%. So you would have two funding sources paying for one program, and they're interlocked, right? I'm not talking about duplicating, right? I'm talking about how they interlock with each other, because often when you write a grant, you don't know all the components for the next 2 years. You might discover, oh man, we forgot to include this. So I'm going to go get funding from somebody else and I'm going to put it in here. All right. Okay, here's your guiding questions, right? Who should be in the review and discussion? This is your advisory folks. How will you share? What format will you use? SWOT, strengths, weaknesses, opportunities, and threats. That's another one that I've used. I tend to use that with organizational evaluation and not program organization. It's just preference, you know, and your sustainability and how will you track your progress and your challenges and what you're going to do. Again, these are the questions you should be answering. These are in the toolkit. These are the questions you should be answering. How are you going to carry this forward? And what you learned here today, you know, um, it can't just fade away in the next 10 minutes because you're done with this course. answering these questions, bringing these questions forward, bringing more people in, that's how you're going to find success running peer support services. All right, we've reached the end of this presentation. I hope you've enjoyed this. Again, this information comes from the Peer Recovery Center for Excellence. This is part of their toolkits for measuring peer recovery outcomes, the impacts of peers. Um, the toolkit itself is in your files section, and it's just packed with a ton of great information. And I've just done a brief overview of it here. Sometimes that helps people to understand, right? And so read through it. I didn't cover everything that's in the document. A lot of time and a lot of effort, money went into developing this. These are best practices. We talk about these things, and we say, oh, I went to this training or I went to this conference or, and just like we're talking about here, how are you going to sustain this into the future? Because 10 minutes later, you're off to lunch or whatever you're doing, and you're going to start forgetting what you learned here. And when we learn in an online format like this, it happens even quicker. So those guiding questions, take some time, answer them, work on them, develop them, implement evaluation. You will find you'll have a lot more success in your program because you'll have happier employees, you'll have more effective peer services, and you'll have the funding to do the things you want to do. Thanks so much for tuning in. Again, I'm Jim Haney, the Executive Director. Please visit our other courses that we have in the LMS. Invite you to do so. There's a lot more information about organizational building that is available. And at any time, if you have questions, you can always email me, um, jim@mtpeernetwork.org. Thanks so much. Bye-bye.